The overall incidence of postpartum hemorrhage is anywhere between 1 and 5% according to recent studies. But a woman's risk for postpartum hemorrhage really depends. There are a lot of different risk factors, and you wanted to know specifically if you have had a postpartum hemorrhage in the past, if you're at greater risk for it happening in the future. And the very fact that you've had a postpartum hemorrhage in the past, especially because it sounds like it was pretty severe, you had to have a blood transfusion, does put you at risk for having another one in the future. It automatically puts you in a high-risk category. With that said, there are circumstantial risk factors that may not happen in future pregnancies, which put you at risk for it the first time. Some examples include an extra large baby, prolonged stages of labor, whether it be the actual laboring process or the pushing time. These are defined as the first or second stages of labor. Abnormal placental attachment, the placenta pulling away from the uterine wall prior to delivery, and preeclampsia also put a woman at greater risk for postpartum hemorrhage. It basically comes down to 3 different causes for postpartum hemorrhage, the most common being uterine atony, where the uterus just doesn't want to contract down. And things like having an abnormally large baby or having uterine fibroids or an abnormally long labor just might make it so the uterus is plumb tuckered and doesn't want to cramp down. Other causes include retained placental pieces or a laceration inside that's not immediately apparent to the provider at the time of delivery. And so if it continues to bleed, then this can lead to postpartum hemorrhage. And so these are all things that a doctor will think about after delivery if a woman starts bleeding more than they would expect them to bleed. And again, some of these risk factors are circumstantial, and so they may or may not happen again in the future. The most important thing is that your doctor knows about your history of postpartum hemorrhage going into it, and that they plan accordingly during your labor and leading up to delivery. There are some things that they can do in an effort to be more proactive instead of just reactive to bleeding. They can discuss these interventions with you, and so I do suggest talking with them about it at your next OB appointment, and based on their knowledge of your history and circumstances, they'll be able to give you tailored information and advice. Good luck with everything, and if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.